Kidney stones are silent in the beginning. What does it mean? It means that kidney stones are formed as a result of supersaturation of urine with extra amount of solutes which actually join in and probably start nucleating, then aggregating, then crystallizing, and then gradually getting bigger and bigger, very slowly and silently. When do stones form? So stones form in you and me at the point in time when we are undersaturated, in times of intermittent dehydration that we continue to have, and we're speaking in summer season from the Kokila Dhirubhai Ambani Hospital Department of Urology. So an awareness drive which goes very deep into stone treatment, stone therapy for kidney stones. We're not talking about gallstones. Gallstones have different reason of formation. And if gallstones form and they actually are symptomatic, then we probably remove the gallbladder and the gallstones together. So the gallbladder is removed. Not so in kidney. The kidney needs to be preserved for health, for future, till the point we are going to be here. So the kidney stone awareness comes directly to you in terms of the stones forming as a result of things happening in urine, and not because of seeds that we eat in guava and lady's finger and tomato, which is a myth that we need to bust, and we keep doing it from this platform very regularly. So stones form as a result of supersaturation of urine with excessive amounts of products which are being brought into the kidney by purification of the blood. Blood is that internal environment or the hormone which actually balances the entire body. Anything which is high in the blood, which could be uric acid, which could be calcium, which could be oxalate, which could be phosphate, and the host of products which could be high and they need to be maintained into an internal environment. The kidney acts as the bandmaster of the entire orchestra, and it looks at purifying the blood all the time, 24/7. You could be at work, you could be sleeping, you could be abroad or traveling. The kidney is working non-stop for you. So salute your kidneys for keeping your body completely purified and stable. Anything goes wrong, you see blood reports and find that there's a panic on blood reports going wrong, partly because something is very high and is not being drifted away from the blood into the kidney. So kidneys work as purifier for your body. So all those people whose kidney functions are maintained and not in kidney failure or AKI or acute kidney injuries because of various toxins, it is important for us to understand that everything which comes into the kidney needs to be brought out and exited through the urine in a liquid state. That liquid state is called urine. So I call urine as a sharbat, where there's a dissolution of the water with all the solutes, and it's in a dissolved form. You can't see anything. When you pass urine, it can be a little concentrated and dark color urine in this summer season. But frankly speaking, you don't see any solutes coming in and out. That's how urine is so clear kind of thing. It may not be pure, but it's very clear. It's a waste product of which we sadly don't talk much, but it's a very important aspect of life. It's a great marker. Anything wrong, anything poisonous, anything can be picked up in urine and can be told that this is something which is missing. So friends, urine is a great marker, and it tells us about the concentration of urine when we do a urine routine test. The pH of urine talks about an acidic urine. The specific gravity talks about the concentration of urine, and all those which are high in there. Proteins are high, glucose is high, bacteria are high, tells us about your infection, about your kidney state, about the injuries which are gradually happening. So saluting the kidneys, which actually work as a very silent marker. World Kidney Day every day, year is celebrated to remind you of the next 364 days. The kidneys are working non-stop. So when do stones form? They form at the point in time where there is intermittent dehydration or supersaturation of urine. So imagine you don't drink water from morning till evening. You're very busy soul. You're busy working for yourself, for the organization, and you forget drinking water. You drink water only when you're thirsty. Sadly, everything else is interspersed with tea, coffee, and other drinks that has become a part of modern life. And in doing so, the body has not got enough water, which needs to probably be excreted along with all the solutes that are coming and being brought about by kidney from the blood. So blood is being purified. A lot of solutes are coming into the kidney, but it has to be dissolved. And that dissolution can best happen if you are hydrating yourself well. I didn't say hyperhydrating or going into an essential polydipsia where you drink. But yes, your ways of drinking water is also an important aspect to looking at how do you care for your body. So people say, बहुत पानी पिएंगे तो बहुत यूरिन पास करना पड़ता है. But यूरिन पास करना ही आपका काम है. बाकी काम तो आपकी बॉडी ऑटोमेटिकली कर रही है. Your heart, your body, your kidneys, your brain, they work automatically. They don't take your permission. They work in a very different tangent altogether. And that's why we all are doing so well in life, so much regenerating every day, and everything is in sync or in harmony. That is homeostasis of the body. So let's go back to the kidney stones. Summer season, more and more stones will form because our drinking habits have not changed. But the amount of solutes which come into the situation in a period of dehydration, which is long, which is going to stretch for 4-6 months in the year, it's important for us to wake up to hydrating ourselves very well. So improving our water intake before and after principal meals is what I continue talking every day to my patients who form stones. Not to everybody, but then let's understand that hydration is a part of the gift that we give to our body to keep it well energized. Imagine Indian women who do this vrat, and when you do vrat, you are actually dehydrated. In these periods of fasting, which is also going on religiously right now, we have a lot of people who are fasting kind of thing. Fasting states, body actually, compensates by producing extra amount of water or liquid to be dissolving the solutes to bring it out. Anyway, the kidney has to produce only liquid form and not solid form like the stools. So for the kidney to function, to assist and aid by improving our water intake across the day and night is the way we'll be producing dilute urine, non-concentrated urine, and urine which is not smelling too much. Remember, an acidic urine can smell too much. Urine which has got stasis, which doesn't drain out completely from the urine, but the bladder can actually be very smelly, kind of very pungent smelling, foul smelling urine, which people complain about. Also in urinary tract infection. So if you take it forward, stone formation, which happens very silently and gradually by nucleation, aggregation, crystallization, growing gradually up to this physical property enhancement, can be of uric acid stones, calcium oxalate stones, stones which could be triple phosphate related from the infections, again silently. Our job is to look at how do we prevent stones and how do we treat stones. So prevention of stones in stone formers is be aware that once a stone former, always a stone former. If you form stones in the past, you'll form stones again. Again, it will be very silent. So I said, silent stones grow and they continue growing till a point in time. Either they become big enough and you visualize and wake up to it. But sadly, you have been doing ultrasounds every year and only monitoring stone rather than treating it and curing it. On the side, one of these nights or one of these days in a wrong time and location, the stone can fall down the kidney. When it falls down, you possibly could have trouble. The kidney pipes are very narrow and there's the possibility that the stone can get blocked anywhere. For example, just look at this picture here. That's a kidney and the stone has fallen down and blocked the ureter out here. So there's a stone which is blocking the kidney pipe. Sadly, a very common emergency for a urologist across the country when we get to see this kind of situation. So let's wake up to the phenomena that we will not let stones happen as stone formers. We'll work hard. And there's a huge list of metabolic evaluation that we do to look at what could be high in the blood that the kidney brings so much into the urine, and what is high in the urine that is not getting dissolved like everybody else in the home who's eating the same food and it's not getting out. So remember, eating something doesn't form stones. That's something very important. People keep asking, kya nahi khayenge, kya pura band karna? We avoid something, stones will not form. It doesn't happen so. It is a way the body metabolizes and probably prevents stone formation is a lot aided by you by looking at the right products that you need to give. So on one side, your hydration, your prevention of supersaturation of urine is one part that you can do. Other side, you can look at amount of citrate in the urine, which could prevent calcium oxalate, the commonest stone forming. So if calcium and oxalate don't join together, stones will form. They actually get dissolved in the urine and pass off into the exit that you continue doing it. Very important aspect to know that calcium oxalate join together only because there is less amount of citrate in urine. Citrate not being there, calcium oxalate have this binding capacity. दोनों की शादी हो जाती है. So we don't let them join by improving the amount of citrate in urine. And that's best available by lemon, orange, and by amla. Things which actually could help you out in terms of getting the calcium oxalate not joining together and getting washed off. And you don't blame the food that you eat every day. But yes, too much of tea, coffee, cola, chocolates, green vegetables, milk products, and animal proteins is not the best thing to have in stone formers, at least. Stone formers, if are actually bombarding the body with too much of oxalate already. The oxalates do form internally. There's enteric hyperoxaluria, which is a very important cause of looking at how oxalate is generated in the body and form stones. There's too much of oxalate coming in from the huge amount of cola drinks and the tea, coffee, etc. that we indulge ourselves all through the day and night at Starbucks is an important aspect. Okay. So friends, stones do gradually form, join, and become a big stone. Let's look at a big stone. That's a big stone. You can see the stone is big. It's a big one. And that's approximately 1.5 to 2 centimeter stone. And that kind of a stone needs to be operated and cleared. So if that's a kind of stone, it gradually forms from the powder which join together. Joining of the powder is something which join together to form a big stone. And what does the urologist do? He again powders the stone and then removes the powder. It could be large pieces, pulverize it around. So imagine something which is gradually joining and becoming a big stone. As what in the operating room with a laser, with a lithoclast, we powder into smaller pieces because we need to pull it out from the kidney. Either we large stones puncture the kidney and go inside and remove it completely, or we take a telescope through a very narrow pipe and do a ureteroscopy, or enter the kidney and clear stones by flexible ureteroscopy. So remember, the pipes are very narrow. If you look at this, and the kidney pipes are very narrow. These are ureters through which urine comes out. a stone big enough may fall down into the ureter, but may get blocked anywhere. And as it comes lower and lower, the more the trauma, more the injury, and more the amount of chances of it getting blocked. The lowest part is the narrowest part. So this is what is a ureter or a kidney pipe. A smaller stone can get blocked anywhere up to down, or a large stone will get blocked upstairs. So our aspects of care necessarily goes down to the society to make them understand that if you have a stone in the kidney, what will happen to it? Either it will gradually grow in silently and you'll be waiting. You may not be knowing the consequences of it. It will gradually become from few millimeters to a centimeter and beyond. And then you will wake up to a phenomena because it may then move, it may bleed, it may give you a pain. So a small stone is where we need to treat so it doesn't become too big. Obviously, we don't treat 2, 3, 4 millimeter stones all the time. There is an aspect of care where these are aggregating to become bigger. And there is a huge amount of churning that we bring about, both with diet, therapy, medical management, that you don't let it grow. You look at the causes of stone formation, etc. On the other side, necessarily, it is important for us to wake up. We need to wake up that these stones can fall down, can grow bigger, and probably can trouble us around. So we need to wake up to these kind of aspects of care and take it to the next level completely. So when we look at that therapy, we are obviously looking at, is there a way we can treat such patients by making them understand more? So first aspect, start treating them and start making them understand around. So as a urologist in this country, what do? We make you wake up that these stones can be trouble. These stones need to be treated in time. The stones can either fall down, block, and probably cause trouble in terms of ureteric colic, an emergency which can happen. On the other side, these are the stones which could be trouble in terms of growing bigger and bigger and bigger. And then we would need a PCNL or a puncture. So once a stone former, always a stone former. Work hard towards prevention of stone, an aspect which is very, very important, an aspect which we need to take to the next level around. Summer season and awareness will never go away. It is important for us to be really aware. And awareness is what was to be bringing out to you at this aspect of care, because if we don't make you aware today, you would sit on a stone and said, this stone was treated and my next stone may probably come up. It is important for us to therefore look at, once a stone former, always a stone former. This therapy is done today, but work hard towards prevention of the next stone. Thank you so much.